One source for local news, KTLA 5, LA's very own.
The coronavirus continues to be on the top of all of our minds and what we can do to protect ourselves from the pandemic.
Yeah, we're joined in the studio now by Dr. Brian Fletcher, who works in the emergency department at Providence St. Joseph Medical Center. Welcome, Doc, to the set here. You've been exposed to the virus a number of times already.
Well, I'm not certain about that. A lot of healthcare workers will undoubtedly be exposed for sure, so it's not clear who has and who hasn't.
You're feeling fine. You're not showing any symptoms of it, just to play it safe here?
I'm feeling great.
So tell the people at home, what are the symptoms they should be looking for at this hour?
Well, the first thing I actually want to say is don't panic. Most of you are going to be completely fine.
Sure.
And even if you do get it, 95, 97% of you are going to be completely fine and display very few symptoms. The symptoms include mostly fevers and cough, and then if you have some of those, you should call the emergency department first before you just go there.
And we're talking high fevers? Or?
Well, it's still under study and under investigation. We're not exactly sure. We've seen a lot of high fevers, like 102, 103, but we have seen some low-grade fevers in some cases with no fevers at all.
All right, so what should people do if they are exposed to the virus?
Well, first of all, you should look out for signs and symptoms. If you have a fever and a cough, that doesn't mean you have it. Do not rush to the emergency room because we will not test you. We have a rigid screening process. What that means is you should call the ER ahead of time, or your doctor, or a teledoc, and just explain your symptoms. And most of the time, unless you're really sick, but just have a fever and a slight cough, we'll tell you to stay home, because the treatment for influenza or a common cold is to stay home, essentially kind of limit your contact with everybody.
Yeah, well, let's talk a little bit about that then. People coming in with various levels of various symptoms. How's that impacting the hospital as a whole?
Well, we have tents set up outside for a triage process, so that helps a lot.
Sure.
And everyone has universal precautions, and so when people try to check in, we ask them standard questions, or if they're worried that they have it, they go through this tent process first, and then we decide based on that who is going to get tested and who isn't. We have a very limited number of tests in California and the country as a whole.
Well, we learned earlier in the press conference that 1.9 million tests will be sent out, but I know my doctor doesn't even have the tests.
We have a very limited number, but to put it in perspective, you said 1.9 million tests. California has over 5 million citizens over the age of 60.
Okay.
Yeah.
Wow. Do you think, or do you see this pandemic slowing down anytime in the near future?
No, I don't. It's actually going to get a lot worse before it gets better. Again, don't panic, but we're now just sort of entering the phase. Today, we have the same number of cases that Italy did on March the 3rd. So it's going to ramp up. But again, don't panic, because most of you, almost all of you, are going to be completely fine or have very low symptoms, or you may not even know you have it at all, which is why we're telling everyone to stay inside.
Yeah, and if you don't know that you have the symptoms, or you're not showing any of the symptoms, then how contagious are you to other people you may be passing in the hallway or in the shopping?
You're still quite contagious. It's done through what we call droplet precautions, so like coughing on somebody or touching a surface and then someone touching that surface. So that's why everyone is urged to use hand sanitizer and wash their hands for 20 seconds.
How do you feel about all these people hoarding supplies at the grocery store?
They're jerks.
Yeah, I think the big question is, like, why are we hoarding toilet paper again?
Well, because if you're staying inside, you're going to need it. But I guess what I mean by that is don't hoard supplies. Grocery stores will not run out. We still have a food supply. We still have a food chain. The food will come back. Paper towels and toilet paper will come back. So don't panic.
The fact that the governor now is calling for restaurants, bars, all these types of things to shut down, we know that some places out there are probably going to remain open. How big of a deal is that really as far as the transmission's concerned?
It will actually drastically reduce transmission. So what we're thinking is what we call flattening the curve, which is if you severely limit people's interactions, that will help stop the spread much more quickly. So yes, restaurants will suffer, businesses will suffer, but if you do it quickly, it's like ripping the Band-Aid off, right? So it's there for like a month, and then they can get back to business. But if people go out and continue to infect each other, then it could last for 3 months or longer.
Are we ahead of Italy, like where they were at that point?
No, we're going to get to that level, but we have a much larger population, so it'll affect less people, but you know, it's still going to hurt.
And a lot of people out there are obviously worried about getting it, and sometimes we're joking about how easy or how not easy it is to get it. You're right there. I mean, you're on the front line of all of this. Is there a concern in the back of your mind that you're a little worried about this whole thing?
Sure, yeah. Everyone I know that I work with, doctors, nurses, technicians, phlebotomists, we're all kind of in the back of our head wondering how we're going to be exposed, when we're going to be exposed, continuously exposed, and we know we're going to get exposed. The question is, are we going to get infected?
Are you
Right.
finding that friends aren't calling you as much as they used to? Don't want to hang out with you as much?
Everyone wants the elbow bump. I'm okay with that.
Right. Well, you're in one of the professions, as are we, that we can't stay home. We have to show up
True.
and continue to help people.
And
Exactly.
we appreciate everything that you're
Sure,
doing
happy
out
to
there.
help.
So
That's what I was
much.
called to
And
do.
thank you for coming in today.
Of course, I
Yeah.
appreciate it.
Shed a
Good
lot
luck.
of light on it.
Thank you
Good
so
luck.
much.
Stay safe.
All right, let's throw it over to Casey. Talk a little bit about that rain out there. How long is it going to stick around?
Oh, for a while, Rick.